Okay, today I will be interviewing Monica Torres, who has been an RN for 12 years and currently working in the Department of Oncology. So, first question is, Monica, describe your experience in nursing school.
Okay, so when I was in nursing school, of course, it was very hard and very stressful. But I had a lot of support from my teachers at school and at home, so it was made the process a little easier. I also always took the opportunity to learn when I had a chance during clinicals. Whenever I could, I would take on an opportunity to do hands-on because that's the way I learned that I learn better is doing everything hands-on.
Okay, and during your years of being an RN, how would you handle crisis?
So whenever I would be in a crisis, I've learned that I need to stay calm and focus. Also during crisis, well, throughout the years when you've had many of them, I've learned to remember little details, like write down the time, also to call a family member. So when decisions have to be made and the patient can't make it, the family member can make those decisions. And also, whenever the crisis is over, a very important thing that you have to do is document everything. So I've learned that you have to document what time did everything start. So that's why now if a coworker or if I have a situation, I just look at the time and I just write it somewhere so I know what time everything started.
Okay, and what are your greatest strengths?
I think my greatest strength is I treat everybody the same with the same respect and the best care. During COVID time, I've learned that many nurses or nurses aid would forget just like basic thing like mouth care or changing of gowns because we were so overwhelmed with the COVID patients. And we would just go in there and just, give them their medications that we needed, but we didn't do like oral care. So their mouths would be dry or their gowns would be dirty. So I just kind of just remember like they're still patients and they still need basic care. So I just would sit there and take longer, but I would do the oral care for them. So just treat everybody the same, even if they have COVID or if they in there for something simple. Just always treat everybody the same.
Okay, and how would your colleagues or patients describe you as?
I think everybody describes me as a caring patient and very thorough. I'm a very rule follower. I like everything done the right way. I don't like to skip any steps because I've learned through many years if you skip a step, it's going to come back and get you because you didn't do something. So I always care about my patients, explain to them because even if they're 18 years old or 90 years old, they don't know, so they might be scared. So I always explain to them and educate them of what we're doing. Even if I've been in the room and done it over and over, I still explain. So I'm very thorough and caring. So even when I orientate my nurses, I always let them be hands-on and I always try to remember when I was a nursing student. So I think everybody just describes me as very caring and very thorough. I like things done a certain way and follow rules.
Okay, and what made you become a nurse in the first place?
I like to care for people and help. I've always done that with my family and my friends. So I think this was a career where I can do it and enjoy helping people.
And from your years of experience, what advice would you give future nurses?
Um, so I know with the demands and low nurses right now that we always want to just do things fast and maybe skip a step, but always do the right thing. If you know that you're supposed to do it, don't skip a step because it can come back and bite you. Um, Also, a very important document because if you don't document it, you didn't do it. I had a situation where um, the hospital had come into a lawsuit and they asked me about a patient that happened 5 years ago and I couldn't remember, but they were looking at my documentation. So I always document everything because if you didn't document, you didn't do it. So I would
When you
just
when you
recommend.
when you document stuff, is that like in a notebook, like
No,
your
it's
own
on the
personal?
computer.
Okay.
It's on the computer. You have to document everything that you did, what time you went in there. And of course, they make it easier. We just click now. What did you do? Oral care? Did you, do things before surgery? Did they have belongings? So just always document. That's very
And that's
important.
always saved in the system.
Yes.
Okay.
Even if you make a error and like let's say you document on the wrong patient, even if you fix it, it'll still be on there that the first thing you documented, but you documented on the wrong patient, but it'll always be saved on there.
Okay. So tell me about a time you dealt with a unhappy or difficult patient or family member.
Um, so when I've dealt with the difficult patient, I've always tried my best to figure out what I can do to make the patient happy or talk to a charge nurse or a manager to help them. Now, if it's a family member that's interfering with patient care, so I have learned over the years, sometimes you don't know what family members can be capable of, or patients, of course. So, just for safety reasons, when you're addressing a situation, I always just call security, just not for them to necessarily speak with them, just so I can just have them in the room. Because sometimes when you try to do your best to make them happy or do what they want, sometimes you always can't do that in the hospital and they get angry and you don't know how their anger is going to escalate. So for safety reasons, I always just call security just to have them not even in the room, maybe just outside of the door, just for my safety, because have had patients lash out at me. So I've learned to just, my safety is first because I can't take care of my patient if I'm hurt. So just security, or a manager or another nurse, just have somebody else in the room with you.
Okay. And can you describe a time a patient was really happy with your care or a time you went above and beyond for the patient?
So I work in oncology and we also do a lot of comfort care for our patients. Um, and I had this one patient that was an end of life, like they were already passing and they had their family there and everything. And the patient wanted their dog there. The dog was very like family to the patient that was passing. So I talked to my manager and I talked to like the house supervisor and see if we can make it where we could bring in her pet. And we were able to do that. And the family was very grateful that while she was passing, she had her dog there with her while she passed on. So,
Okay. And describe a situation when you had to work with a difficult coworker. What was the problem and how did you resolve it?
so dealing with the difficult coworker, you always, instead of talking to somebody else that you don't have a problem with, just talk to them directly. Because sometimes when you talk to another coworker about the problem, then you can create rumors at work and it just makes it worse. So always just address it with the person you're having a problem with. In my situation, I had a problem with the charge nurse actually. So in my job, charge nurses would get there first because they had more responsibilities. So they would get there 30 minutes before just a regular staff nurse. So this charge nurse in particular would always change the assignments that were made by the day because I work nights that were changed by the day shift. When she would come, she would change the assignments where it was a little bit more easier for her. And I just addressed it with her, like, that's not fair. And we just need to leave the assignments like they are to make it equal and fair for everybody. And she stopped changing it for a couple of weeks. And then after she started going back and changing it. And so I just addressed it with my manager after I already spoke with her directly. And then the manager had a talk with her. So she doesn't do that anymore. So just, if you ever have a problem, just speak with the person directly and just try to resolve it yourself first.
Okay, and the last question, describe a situation where you displayed teamwork.
Um, I think whenever you are in a crisis, you need your coworkers there. And in a situation that I was in that I remember that we all helped in was it was not my patient, but it was one of the charge nurses' patients that she was orientating a student actually. And the patient had a really low blood sugar and she went into a seizure. And when she went into a seizure, she started just ripping things off. So she lost her IV access. So there was no way for us to give her our nurse's aid. She checked the blood sugar first, and we all went in there as a team, and I started an IV. The student was helping the patient so she wouldn't hurt herself as she was having a seizure. And the charge nurse, she called what we call my hospital is called a MIT team, which is a medical intervention team, which is a team that gets there. And we all helped as a team, and we got her feeling better. And she woke up after she had her sugar, and she did not remember anything. She was very pleasant actually when she woke up. But we all went there as a team and helped the patient because in the end, it doesn't matter whose patient it is. We are in there for the same reason. We want to help our patients get better. So we all worked as a team and we got her sugar up. It was really low. I think it was like 26. So it was low and we all helped her get better.
Okay, that's good. So now if you want to go ahead and ask me the questions.
Okay, so Lorena, I want to ask you, how would you handle a crisis?
The way, well, I've had 7 years working in the ER as administration, and the way that I've learned how to handle a crisis is by staying calm, mostly. Stay calm and think very clearly about what you're going to say and what you're going to do. You have to stay ahead of the game. And also, you have to work together as a team. I knew I couldn't do
Mm-hmm,
specific things because I'm not a nurse, but I knew how to help nurses to get a patient to the back, who I had to call, charge nurse, etc., to get the ball rolling. Because sometimes, for example, if we had a gunshot wound and patients all panicking, you have to think quick. And that's when the
mm-hmm,
phone calls start. That's when the nurses start coming in and make sure you get patients' information correct in the system. You don't, that's a big issue too. You have to make sure the name's right, date of birth, and it's the correct person. If there's any family members, have them wait in the family room. And then as soon as the doctor says, yes, the family can come on back, then they come on back. But mostly just staying calm and know how to talk and say what you have to say clearly.
that's very good. Okay. Another question I have is, what are your greatest strengths?
I think my greatest strength is making people laugh. I've always been really good at making my patients laugh for some reason. And to me, that makes me feel better because when you're in the hospital, you're ill, you're injured, or whatever it may be, and if you can get a smile out of the person, it makes them forget a little bit of what they're going through, because some patients have harder situations than others. So me just making sure if they need anything else, how can I make their stay a little bit better, or just having a simple conversation, because some patients, they just want to talk, they want to be heard. So I think that's one of my greatest strengths, is that I'm able to get a smile or a laugh out of a patient.
That's good. That would definitely help you.
Yeah.
Um, Also, next question. How would your colleagues and patients describe you?
Well, most of my colleagues describe me as loud, crazy, and funny. Those are their words, not mine. And I think it's because of the way I communicate with everyone. I like to speak to everyone. It doesn't bother me the level of employment that you're on or who you are. I'll talk to you. And
Mhm.
I think that just helps a person, an employee, work better when you have someone that's willing to communicate with you and make them laugh, again, situations like that. And also, I think they would describe me as working great as a team player. Like when we all have to work as teamwork, I'm really good at that. I rather work together than work alone, because we can get things done a lot quicker.
Yes. All right. So my next question for you is, why do you want to become a nurse?
The main reason why I want to become a nurse is because, again, working in the ER and working under administration, I would feel hopeless when I couldn't help someone physically, when I knew that they needed medical attention and I couldn't do anything. And that made me feel like, no, I want to do something. I want to be there trying to save their life or help them. And that just, seeing it every day just made me want to become a nurse even more. So that's the main reason. I just want to help people get better. I want to be in the action.
You will definitely see
Oh
action.
yeah.
All right.